Good evening, this is Dr. Do again. This video is outside of medicine, continue with the alphabetic list of problem of confusion. I have recorded the video earlier, but when I tried to upload, somehow I turned off the device earlier before the upload finished, so it was not uploaded. And I deleted the video accidentally, so I'm going to record it again. Basically, the confusion or the mental status. Is there any situation warrant an emergency visit? Yes. The confusion alter the mental status either caused by the either lost consciousness or in elderly people or had systemic disease such as chronic liver disease, such as chronic kidney disease or diabetes or hypertension or arrhythmia, cardiac disease, etc. So basically for older people, dehydration or urine tract infection even could cause the confusion or alter the mental status. Is there any situation that confusion or alter the mental status you can manage at home? Very rare. The only cause I can think is you just went outside for a long time without drinking fluid. When you came home, you feel like you're not yourself. This might indicate just the dehydration. So if that's the case, then drink some electrolyte water with some salt, with water. See whether you can feel better. If not, go to call your physician or go to emergency room. Okay, so this is the introduction of confusion. What are the causes for the confusion? I was stratified in the age group. For example, the elderly, from very simple, probably like I said, dehydration is one, or urine tract infection is another one, without any systemic disease. Just the healthy older people also can have this etiology cause the alter the mental status or confusion. Could be very straightforward, just simple drink some fluid will feel better, or could develop complications, very serious complications. So if that's the case, regardless of the cause, if you have elderly live with you or you're yourself is kind of belong to this elderly category, and you feel like you're not yourself, or your family member felt that you're not yourself, has confusion or change mental status, then call the emergency or call the physician, discuss, or just go to the emergency room right away. And for the elderly people, there are another group with systemic disease such as hypertension, diabetes, or chronic renal disease, chronic liver disease. These or other systemic disease can cause the confusion or alter the mental status. For example, if you have diabetes, you used to eat a regular amount of food for a while, and suddenly you want to change your lifestyle, you cut your food intake, or you increase your exercise level, but at the same time you did not adjust the insulin, so then you maintain the high insulin dose may cause the hypoglycemia. Hypoglycemia itself can cause the confusion or alter the mental status. So if that's the case, call your physician or drink some fluid, drink some juice, orange juice. If it doesn't get better, call your physician, go to emergency room, because hypoglycemia is quite dangerous, especially if you're elderly patient. Of course, another like chronic kidney disease can cause the imbalance of electrolyte. If that's the case, can impair the nervous system function, can cause the confusion, alter the mental status. The same idea for the chronic liver disease, because we all know liver is a detoxification organ. So if the liver has a chronic disease, then the toxic or the toxins accumulated in the body will damage the brain, so cause the alter the mental status. So these are for the older group. For the younger people, what are the major causes for altered mental status? Fever is the one. An infection, either viral or bacterial, cause the high fever and not bring down, especially if the infection occur in the nervous system. So that's the common cause. The other is cause is congenital heart disease, either caused arrhythmia or cardiac valve disease or cardiomyopathy or even endocarditis. These are all the possible causes for confusion and change in the mental status. On top of that, for the young people, the other cause might have the other cause for the confusion is the medication. For this medication can happen both elderly and young people. For example, for the elderly patient, either healthy or with systemic disease, without adjusting dose. A lot of over-the-counter medication or prescription medication need to adjust dose for the elderly because the kidney function declined with age. So the other for the young people also, a lot of medications can cause if overdose or not follow the instructions for the physician can cause altered mental status. And the other, of course, the delusion, delirium caused by the alcohol also can cause altered mental status and confusion. In children, confusion or altered mental status is basically fever, infection is the most common one, or there's some genetic disease, known or unknown to the family or to the patient. So this is the summary. On top of that, there's another cause for the altered mental status or confusion, of course, is the trauma. It's you probably had a recent trauma or a couple of weeks ago, you did not seek medical attention and suddenly feel confused or altered mental status or even a lost consciousness. That probably hematoma growing big enough to cause this altered mental status and change the loss of consciousness. So if you had brain injury, regardless whether you lost consciousness on the scene or you did not, seek medical attention, get a image study, make sure there's no internal bleeding caused hematoma. So these are the confusion with or without lost consciousness, with altered mental status. I can think what kind of situation you need to visit emergency, what kind of situation you may manage at home. I'm kind of, unless if you want to manage at home, those are really, unless you've been very healthy, you're young, you knew you just exposed the extra heat for a long time without a replenish of water, you feel dehydration is the cause. If that's the case, you can manage. Other than that, I really recommend altered mental status, go see your physician to check it out. Probably can identify some medication which unknown to you, so which is start early to treat and to prevent further prognosis to the further progresses to worse complications. So this is for confusion, and I'm going to stop here and hope it helps. And thank you for watching. I'll see you next time.